actually have a photo of some babies who have an upper lip tie, so this probably better explains what you're discussing, right? Correct?
Yeah, so the upper lip, in fact, look at the picture in the very center. Do you see there's like a little bubble on the baby's lip?
Yeah.
That's a blister.
Oh my gosh.
From nursing with your lip curled
and not
under.
being able, right.
And you see how tight that is? You should, in a baby without a tie, you should be able to pull that lip right up over the nose.
Okay.
And then also if you look at that center one, you see the tongue is coming up, but it's still held down at the base.
Right.
And so those tongue ties can be very difficult to diagnose just by looking at them.
Right.
Some of them are way back deep at the base of the tongue, and unless you know what symptoms to look for, you might say, oh, well, looks okay to me.
So in that case, what symptoms are you looking at?
I'm looking at inability to latch. I'm looking at mouth breathing. No baby should breathe through its mouth. These babies often hate lying on their backs because they can't keep their tongue out of their airway. These are some symptoms that are typically listed. Difficulty lifting the tongue. Sometimes just the front of the tongue will lift up. The trouble sticking out of the tongue is a symptom that's frequently listed, but some babies with tongue ties literally have a tongue thrust because the only direction they can move their tongue in is forward. But what you really need for nursing is up against the roof of the mouth. Not just forward.
Wow.
And so once we release that tight frenum, the baby might take a while to learn that thrusting isn't what we want the tongue to do. We want it to go up. But they're very clever. They learn really fast.
Now, Jennifer, let me ask you, do you see this often with maybe some infants or even we're going to discuss toddlers that have difficulty and because of this tongue tie?
We actually do see a lot of babies come into the hospital with what Dr. Haller has mentioned. We see a significant population with gastroesophageal reflux disease, where they do a lot of choking, they do a lot of aspirating, they do a lot of spitting up or vomiting. We see a big population of small babies who come in with some respiratory distress that maybe is not infectious, and we really haven't been able to diagnose what's been going on.
Right.
But they do come in with these symptoms and these complaints where maybe the tongue tie hasn't been addressed.